Hello, my name is Heather Orgeron. I'm from the University of South Alabama, and I'm doing a presentation on electronic health records at Johnson & Smith's clinic. This presentation can be used to explain the importance of electronic health records to the clinic patients. Electronic health record or EHR, is an electronic version of a patient's medical history and includes the patient's demographics, progress notes, medical problems, treatment plans, medications, vital signs, allergies, past medical history, immunization data, surgical history, laboratory and test results, and radiology reports. Electronic health records provide comprehensive, real-time health information that is available securely and instantly to authorized users. Electronic health records can provide healthcare providers access to evidence-based tools that can be used to make decisions about patients' care. This can also help healthcare providers more effectively provide safer care by helping to diagnose patients and decrease medical errors. Electronic health records can be shared with and updated by other healthcare providers, which allows for higher quality, better managed, and safer care for patients. Electronic health records provide the patient's current, accurate, and complete information at the point of care while providing quick access to patient records for more coordinated and competent care. Electronic health records also help healthcare providers provide safer and more dependable prescribing and help to promote accurate and complete documentation. Electronic health records help to reduce healthcare costs by improving safety and health, promoting preventative medicine, encouraging improved coordination of healthcare services, and decreasing the number of duplicate tests. Electronic health records promote better healthcare by improving patient care, including safety, effectiveness, education, patient-centeredness, timeliness, communication, efficiency, and equity. Electronic health records allow for your healthcare provider to quickly identify medication interaction and potential allergies. Electronic health records can save time when the patient arrives at the clinic because the patient will just have to notify the nurse of medical technician of changes since the previous visit instead of having to write out a full history, including medications, surgical history, or medical conditions at each visit. Electronic health records have shown to contain fewer health information and medical errors than paper charts. Electronic health records help promote communication between each patient's healthcare provider because each healthcare provider has access to the patient's full medical history instead of just an overview of the current visit. This can lead to faster and more accurate medical diagnoses. This is especially helpful if the patient has several healthcare providers or specialists. Healthcare providers can also track data over time. Electronic health records allow healthcare providers the opportunity to follow up with patients and have continuity of care because health providers can see test or lab results and can review these results with the patient. In emergency situations or mass casualty situations, electronic health records can provide critical, life-saving patient information to emergency care providers because the electronic health record can be viewed at the hospital. Electronic health records are also beneficial if the patient is unable to communicate with a healthcare provider because his or her family history is already available to the healthcare provider in the electronic health record. Electronic health records are more secure than paper charts because they cannot be picked up and read by anyone in the area. The clinic is Health Insurance Portability and Accountability Act of 1996, or HIPAA, compliant, and requires each user to have a login and password. This password gets changed every 3 months. Audit trails are utilized to track which charts are being viewed by each login and what part of the record is accessed. Automatic log-offs ensure records are not accidentally left open for someone to breach the patient's privacy. Electronic Health Information Exchange, or HIE, allows healthcare providers and patients to access and securely share a patient's medical information electronically. This helps to improve the speed, safety, quality, and cost of patient care. Using Health Information Exchange helps to decrease readmissions into the hospital, helps to improve diagnoses, and avoids medication errors and reduces duplicate testing. Even though secure electronic data transfer is widely available, most medical information is still stored on paper. The sharing of data between providers or to patients is often done by mail, fax, or person-to-person transfer, which can frequently take a long period of time. The Electronic Health Information Exchange cannot replace provider-patient or provider-provider communication. It can improve the completeness and collaboration of patients' records and improve the overall care provided. When you arrive at the clinic, you may see several changes with the implementation of the healthcare record. The healthcare provider may opt to use a tablet when visiting the patient, or computers may be installed in each patient exam room. The healthcare provider may be typing information into the computer or tablet while visiting with the patient. Even though some health information will already be available, staff may initially ask more questions than usual to complete the health record. The healthcare provider will have access to information from recent clinic visits, including laboratory, radiology, and other test results. Initially, the clinic staff may move slower while computers are being installed or the staff is learning the new electronic health record. The clinic may have increased staff members to reduce the wait time and to assist other staff members as needed. Additional staff members may be with your healthcare provider to help them navigate the electronic health record. Prescriptions will now be automatically sent to the pharmacy of the patient's choice. Electronic health records can communicate with a patient portal. Patient portals contain the patient's personal health record. They promote patient engagement because the patient can take an active role in his or her health care and assist the patient in managing his or her health care. Patient portals allow the patient to view lab results, schedule appointments, refill prescriptions, communicate with the healthcare provider, and can provide drug information and historical data. Because patients can schedule appointments, ask for refills, or communicate with the healthcare provider through the patient portal, the patient is able to save time that would normally have been spent on the phone. Using patient portals may also help the patient decrease the number of unnecessary visits to the clinic or hospital. When patients are engaged in their health care, patients are more likely to remain loyal to the healthcare organization. New patients will not have to fill out paper forms when coming to the clinic if they have access to a patient portal because patient portals allow for sharing of health information with healthcare providers. The patient or authorized family member can access the patient portal at any time of the day and any day of the week from a smartphone, tablet, or computer. Health information on the patient portal can also be printed if necessary. If you would like more information on electronic healthcare records, you can view any of these references listed here. Have a great day.